Do you get IT band pain in your hip? If you get IT band pain or pain on the outside of the hip or pain on your hip when you're sleeping on it, then this video is for you. I'm Dr. Dave Candy, and in this video, I'm going to tell you what can cause IT band pain in your hip and some things that you can do to relieve it so that you can walk or run more comfortably, go up and down stairs more comfortably, and sleep better at night. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos. So first of all, what is your IT band? Your IT band is a long strip of fascia, or basically a long tendon that runs from your hip down to your knee. It attaches just underneath the knee, and then it attaches to some small muscles in your hip called the tensor fasciae lata, and one really big muscle in your hip, your gluteus maximus or your butt muscle. And the gluteus maximus and the tensor fasciae lata attach into that long tendon, the IT band, as it runs down the leg. Now the IT band runs over the most prominent part of the outside of the hip. It also runs over the most prominent part of the outside of the knee. And so it can get inflamed in either of those areas. Now that most commonly happens in runners or other people who do repetitive activity with their legs. But in this particular video, we're going to talk about the pain on the hip. Now another time when that pain is really common is when you're laying down on your side and actually putting pressure over that IT band. And I've got another video that will give you some tips on how you can position yourself to sleep more comfortably without IT band pain on your hip at night. But in this video, I'm going to show you some things that you can do to try to stretch the IT band, or more particularly the muscles that attach to the IT band, as well as how you can prevent it from getting inflamed at your hip when you're walking or running or doing other repetitive activities with your leg. Now, if you're looking for stretches for your IT band, I hate to break the bad news to you, but you can't stretch it. It's a dense piece of connective tissue. It's made of strong, stiff collagen fibers. It would take tens of thousands of pounds to stretch it. And if you were able to stretch it, you would probably more likely tear it. But it is possible to stretch the muscles around it, particularly your quadriceps muscle, your outer quadriceps muscle called the vastus lateralis, and the gluteal muscles, the gluteus maximus, and then the small little tiny troublemaker muscle, the tensor fasciae lata, that attaches to the front of the IT band. Now, a common stretch that people show online on YouTube or on Google, if you look for stretches for IT band, is to cross your leg over like that. But if you've already got an irritated IT band, that hyperadduction or crossing your leg really far apart can actually make the IT band more irritated at the hip. So that's not necessarily the best solution. Now, the muscle right in the front of your hip, it's a tiny little muscle like that, the tensor fasciae lata muscle. What its job is to flex the hip, to abduct or move the hip out to the side, and to rotate the hip out that way. So to stretch it, you'd really want to do just the opposite of that. So you want to extend your hip, bring it a little bit back sideways, and then into an externally rotated position like that. Now that's a pretty hard position to get in without falling over, but there are some other stretches that are a little easier and a little more useful to do so. Now, one way you can do that is by kneeling down on the ground, putting your knee down on the ground, and pushing your hips forward. That brings you into extension where your hip is going backwards. Now, note you don't want to allow your back to arch like that. You want to keep your back pretty neutral and just push your pelvis forward. This is actually a good stretch for your hip flexors as well, because your IT band, or rather your tensor fasciae lata, is a hip flexor. Now, to get a little more stretch on that tensor fasciae lata, you also want to externally rotate your hip a little bit, which means turning your foot inwards, more towards the center of your body, and pushing your hip just slightly out to the side. And that way you're getting that tensor fasciae lata muscle, or TFL muscle, stretched without causing so much adduction of your hip, where you're going like that and really just inflaming the IT band over the side of the hip. Now I've got another video that shows you a different way to stretch it, where you're laying on a bed and hanging it off the side of the bed, but we're not really set up right here to do that, so I'll link to that video separately. Now another common thing people do for IT band pain in their hip is use a foam roller. And And this is something that it can be really useful to use. It is quite painful to lay on it and roll over the side of your hip. You put it down on the floor, position your body over top of it laying sideways, and then just roll back and forth along the IT band. Now again, you're really probably not stretching the IT band. What you're really doing is kind of breaking up knots or getting knots to relax in the vastus lateralis muscle, the muscle around the IT band. But again, that's a pretty painful thing to do, and if you have trouble getting on and off the floor because of your hip pain, it may or may not be the best option for you. But if you're someone who runs, if you're a little bit more active, if you don't mind putting yourself through a little bit of pain in order to feel better in the long run, that might be a good option for you. Now, the other thing is, really it's better just to prevent the problem before it starts. So if you'd like to find out how you can stop the problem before it starts, the problem starts because you're pushing your hip too far out to the side, and it's inflaming that IT band every time you take a step when you're walking or running. That happens when you're walking, as you put weight on the foot, you go to take a step and your hip pushes slightly out to the side. That gets accentuated if you're running and doing that fast over and over and over and over again. So how do you stop that from happening? Well, you strengthen the muscles that prevent you from doing this, or rather the muscles that bring you up like that. So a really good exercise to do is just to practice standing on one leg, potentially hiking your hip up a little bit, but just not letting it fall, and practicing squeezing your gluteus maximus muscle on this side that helps hold you up and prevent you from going out to the side like that. Now, if that gets easy and you're someone who wants to run or do something a little bit more physically active, after you master that balancing on one leg, you can start to add some knee bending to it, like you would have when you're going up and down stairs, or when you're landing on one foot from a run where you land slightly on it. If that bending gets easy, you can also start to add some small hops into it and catching your balance on that leg. So those are some tips that you can use if you have IT band pain on the side of your hip. Now, if you need some more help for IT band pain, feel free to reach out. And if you found this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos.